Okay, good day. Our topic for today: assignment, delegation, and supervision. So, according to American Nurses Association, registered nurses are accountable to the public for providing culturally sensitive, safe, timely, efficient, patient-centered, equitable, and effective nursing care for healthcare consumers. So, as a nurse, we will be working in different settings. You might be working in acute care settings, hospitals, long term care facilities, nursing home, ambulatory care, community and public health center, even in private homes and school. So, in those settings, we will encounter people or staff or workers who might be unlicensed and what are the tasks that we can delegate to them safely. So this NCLEX or NCSBN is expecting that as an RN, you will be able to identify the task for assignment or delegation based on the client needs. Delegate and assign appropriate tasks based on the client needs to personnel with competency to perform the task. Delegate and supervise care of client provided by others, like those LPNs, LVNs, assistive personnel, or other RNs. And communicate tasks to be completed and report client concerns immediately. Next is organize workload to manage time effectively. You are also expected to utilize the rights of delegation. We will discuss that later. Evaluate delegated tasks to ensure correct completion of activity. Next is evaluate the ability of the staff members to perform assigned tasks, considering personnel's allowable tasks, duties, competency, and ability to use sound judgment and decision making. Lastly, evaluate effectiveness of staff members' time management skills. Additional reading, you may read Prioritization, Delegation, and Assignment, which the author is Linda LaCharity. So, the main purpose of delegation, assignment, supervision, and all of the things that we will be discussing today is to use resources, our personnel, competently and efficiently to provide safe nursing care. So, prioritization is deciding which needs or problem require immediate action and which one could tolerate a delay in action until a later time because they are not urgent. So, as a nurse, you will be taking care of several patients, more than one patient, except in some situation that you will be doing one-to-one nursing care. But even though you will encounter several problems in rendering patient care, and you have to know which one will be your priority, your number one, number two, number three. Because when a patient is sick, they have several problems. And it's not only that, it's not only what the care that you'll be rendering, but prioritizing which other problems on your end as a nurse needs to be solved urgently or right away. Another term that you will encounter is assignment. Assignment is designating nursing activities to be performed by other nurses or assistive personnel that are consistent with his or her scope of practice or role description. This is defined by National Council of State Boards of Nursing, which is an organization composed of the different states that provide us the opportunity to be licensed as a nurse. So to simplify, assignment is the distribution of work. Prioritization is deciding which one to be dealt with first. Delegation is transferring to a competent individual the authority to perform a selected nursing task in a selected situation. NCSBN 1995. So delegations are activities that you pass on to another competent person or staff that they can perform safely with your direct supervision. So we will give examples later. So delegation generally involves assignment of the performance of those activities to unlicensed assistive personnel, but you will still be accountable as an RN. So having the two letters with your name comes with a lot of responsibility, or we call it accountability. So accountability is both related answerability and responsibility. That means whatever happens in the performance of your job or the task that you have delegated to another person, you'll still be accountable for those. Supervision is the provision of guidance and direction, oversight, evaluation, and follow up by the licensed nurse for accomplishment of a nursing task delegated to nursing assistive personnel. Supervision is self explanatory, but with this, American Nurses Association defines supervision to be an active process of directing, guiding, and influencing the outcome of an individual performance of a task. Say, for example, you delegated the task of feeding the patient. So, if this is your first time working with that a nursing assistant, it is your responsibility to give them or communicate them the steps, assuming that the nursing assistant personnel was trained, but still, you don't assume that they know everything that they'll be doing. You have to give them direction. They will be like, treat them like your clones. So, as a clone, you have to make sure that whatever they will be doing is acceptable to you, and it will be of a high standard that they will do it in a safe manner. Remember, going back to accountability, whatever they do, whatever errors they commit, it's still under your license. So let's define the different characters or personalities that you will be working with. The RNs are the registered nurses, but it doesn't mean that RN is an RN. Not all RNs are equal. Of course, you have to consider the new grads. You have to consider those other RNs that are floating, traveling. LPN and LVN, what are the scopes? Oh, let's go back to RN. RN scope of practice, they are allowed to delegate tasks. They do assessment, synthesis, and analysis of the data. Later on, I'll be giving more examples of that. LPN varies from state to state. There are states that um, they allow some tasks for the LPN to do, depending on their workplace, depending on the company, depending on their training. So different factors. UAP are unlicensed assisted personnel trained to help stable patients in uncomplicated situations, to complete simple, routine, repetitive, common tasks such as ADLs, hygiene, feeding, ambulation. So, what are the factors affecting assignment? Number one is the complexity of patients' required care. Next is the status and stability of the patient. If you will be given an acute patient and this is your first day as a graduate nurse, I think that will be a big problem, not only for you, but to the person, to the RN assigning the patient to you. Complexity of required assessment. So, say for example, this is a stroke patient, and stroke patients require more assessment. Like you'll be doing neuro checks every 15 minutes for the first 2 hours. Not only neuro checks, you'll be doing vital signs. You'll be doing the NIHSS and some other things, some other assessment required by your hospital or institution. Next is infection control. You will encounter patients with contagious diseases. Say, for example, during the time of COVID, they assign one nurse to take care of all the COVID patients. It's because they cohort the patients. They put them in like two COVID patients in one room. But make sure that there are no other medical condition. Next is individual safety precaution. If the patient is a known faller or has recurrent falls, of course they assign less patient to them because they need to monitor the patient, make sure the patient will not fall. Or sometimes they also do one-to-one assignment for those unlicensed personnel. Next is the need for special technology equipment and including training. Some hospitals, they are very particular with the training and they want to make sure they are oriented to that particular unit. Example, if in a tele unit, they require nurses to have EKG training, ACLS, and in the ICU there's a lot of equipment that you need to be familiar about, like the pumps, the equipment for to maintain temperature, like the bear hugger. Um, so there are a lot of protocols that you will be encountering in the ICU, and they cannot just assign you there without proper or formal training and experience. Next is availability of supervising RNs. So, how many RNs are available to supervise the unlicensed assistive personnel? Because remember, if you will delegate something, you have to make sure that there's an RN that can guide the UAP to perform their task. And I'll give another example. Say it's a nursing or skilled nursing facility. The requirement is the company can hire LPN as long as there's an RN in that building. When they need that RN, they are available for assessment. So that's how important an RN is. On the other hand, it's a limitation for LPNs. Like most of them, they have good experience. They've been working in the hospital and nursing home for a while. They know everything. They know the process. But they are not allowed to do assessment or do the care planning. Next is physical location of the patient. Some hospitals have big units, and assigning one patient in one end of the hall and your other patient on the other end of the hall is not really that fair. So most of the time they assign all patients in that one corner to you. Even in the emergency room, that's how most hospitals do it. They have like quads that they call, or areas that they call, and all of the patients that are there are yours or assigned to you. Personal reasons to allocate duties to a particular patient. You'll encounter patients that they have personal preferences as to who their nurse will be. Admit it or not, some patient prefers other nurses, which is fair because nurses also has that personal reasons why they don't like to take care of a particular patient. Other things like religious beliefs, cultural beliefs. So you don't say, for example, you're a Catholic and it's against your belief to support abortion or euthanasia or those with DNR orders, and you don't want to be assigned to those patients, then that's another consideration. Next is, say, for example, you work 2 nights in a row or 4 nights in a row. They will consider whoever patients you have handled the previous night or shift will be assigned to you. You will be the priority to take care of them. Next is the acuity rating system, where they will put numbers or assign numbers in triage depending on the acuity of the patient. And this is based of on the numbers like 1 to 5. 1 are those who will die within hours if you don't give emergent care. So 1 are those with life-threatening condition. Of course, it is not fair and not safe to assign all the number 1s to to one nurse, no matter how good you are. you will not be able to provide safe nursing care to them. So as much as possible, they even out the assignment to all the nurses that are available. And of course, that's another thing factor affecting assignment is how many nurses do you have in the floor? Um, well, most hospitals are encountering shortage of staff, so there are nights that you'll be handling more patients than usual, and not all states are like California, where they have prescribed number of patient assigned to one nurse, and depending on the unit that you will be working. So, example of an LPN scope of nursing practice. This is in New York, where I am currently working. So these are the activities. Excuse me. Activities that the LPN can perform, but this is under the direction of an RN. Administer most types of medications and immunization and blood, uh, but this requires additional training. It says here most types of medications because not all medications will be given by the LPN. There are hospitals, nursing homes where they will not allow LPNs to give medication through an IV. Even with nurses, there are hospitals that will prescribe whatever medications are allowed to be pushed by an RN, depending on the unit. Next is provides bedside nursing care in hospitals and residential healthcare facilities, observes, measures, records, and reports data relating to a patient's health status. Performs clinical procedures such as urinary catheterization, oral or tracheal suctioning, sterile dressing changes, and starting a peripheral IV with additional training. As I've said, this may vary from state to state, from one facility to another. Supervises unlicensed care staff, certified nurses aid in nursing homes, and identifies patients' goals for consideration by the RN for possible inclusion in the patient's care plan. They may identify goals, but they are not allowed to do care planning. Now, these are the task or scope of nursing practice for RNs. They may do physical exams and patients' assessments. They may develop comprehensive nursing care plans and performs nursing intervention like bereavement counseling, ostomy care, wound care. Performs medical treatment, so medication administration, wound care, prescribed by a physician, dentist, nurse practitioner, physician assistants, specialist assistants, midwife, or podiatrist. Next is provides health teaching and emotional support to help patients and their families adjust to or manage serious or chronic illnesses or injuries. There also supervises care delivered by other healthcare personnel, such as licensed practitioner nurses, home health aides, and licensed assistive personnel. They work with the physicians and other healthcare practitioners to ensure that patients receive appropriate, timely, and well coordinated care. They conduct health screening to detect and address signs of early disease or risk factors for disease, and then provide health teaching or make referrals as appropriate. Say, for example, the patient is a homeless patient, So, what are the screening that must be done? What are the problems that must be managed? They can do social work referral. They can do referral to other what do you call this? Other services in the community. So 5 rights of assignment and delegation. Now, 5 rights. As an RN, say for example, you are a senior nurse, or you are a nurse who will be working in a nursing home, and you will be doing assignment and delegation to your people, to your staff. First, you have to consider, is this the right task that I should delegate to my staff? Is this task appropriate for this person? That's the second question. Next is, when you say the right person, you'll consider their training, their experience, their education, their seniority, probably, how many years of experience they have, what kind of training they have received. So you make sure you assign or delegate something to that person that has the good skill sets. Again, as an RN, going back to accountability, whatever you assign, whatever you delegate, it will still be, you will still be accountable for it. Next is right circumstance. Going back to feeding. Feeding is your task, and you know that an unlicensed assistive personnel can handle that, can carry that out. You gave training, you gave education guiding, but say for example, this patient is a stroke patient that has a deficit and they are having problems swallowing. You're not delegating that task so that your life will be easier. And once you delegated that, it doesn't mean that you're done with it. No, you're still be responsible. So if that's the circumstance and your patient is or has dysphagia, if I'm in that situation, I will not be assigning it to that unlicensed assistive personnel. Next is the right direction. So ask yourself, did you give proper guidance and direction when you assigned that task to that staff? Say, for example, you're assigning a patient to another RN. So what are you going to do? You have to explain to them. So this is the case of the patient. Give them the background. This is what you're going to do. This is the priority. And this will be our plan of care. So doing that, you're setting a standard in the path for your other RNs to follow. Say you're giving that assignment to a new nurse, a new RN. So you still have to direct them and supervise them while they're doing that. Okay, next. Other consideration when you're doing your assignment and delegation. I think most of it I have touched in other examples that I have cited. Nursing students. We all know that some hospitals are training hospitals. So, in that case, nursing students are under their clinical preceptors or clinical instructors. But when you assign a patient to them or to the clinical instructor, you still have to supervise, you still have to direct and make sure that the case or the task is still appropriate for them. Again, you will consider the education of the nursing students. Are they on their first? Are they on their third year, fourth year of study? You have to consider, did they rotate in other units? So you have to ask those questions before you assign the patient to those nursing students. Next consideration, if you have a new nurse or new RNs, of course you don't assign the complicated cases to them. Next is floating nurses. There might be time that a unit in hospital will be requiring your help or vice versa. So from your main unit or your staff nurse, so for example, you're a med surg nurse and you're going to a, say, ER. So they will discuss whatever is appropriate for you. Depends on your knowledge, depends on your training. Example, you're an OB nurse or a pediatric nurse. What are the patients, kind of patients that will be safely assigned under your care? Next is infrequent workers. With this, we'll be talking about part-time nurses, per diem, and the seasonal workers or the temporary workers and the travel nurses. I also did some traveling, and ideally what they will assign to you should be the cases that are not so what do you call this? If you're an ER nurse, they will give you time to be oriented to the place and adjust, because it's hard to assign, say, 6 patients to a travel nurse on their third night, and they will be working alone. Of course, they still adjusting. They don't know where to get those materials or equipment, and those can eat up a lot of your time. So, as a nurse, you have to visit, or somebody who's taking NCLEX, you have to make sure you visit this website. I'm not getting anything from this. I'm not advertising their website, but you have to. NCSBN.org, you'll find a lot of resources, and they have the education part, the references, they have videos. Try to study this website because they're the one formulating the exam. Of course, whatever resources or information that you will get from that website, assume that it will be included in the exam. So, if you will be working in a particular state, I think it's also wise to visit their website of the licensing body for a reason. Because here, for New Yorkers or New York nurses, this is nysed.gov. You'll see that here what are the nursing types or nursing professions in New York. So you have an example. Those are FAQs. There are law, rules, regulations. So, see, you can also find here the mandated training that you have to do as part of your license renewal or the first time licensing. You have to do the child abuse training, infection control training. Now, this will vary from state to state, but yeah, you have to be aware of those laws. See, even here, are you required to wear ID badge? And what's the right um, placement of an ID badge? You're gonna just clip it wherever you want it. It must be on the chest. It must be seen. And every time you encounter a patient, you have to identify yourself and your title. Otherwise, you are violating the Bill of Rights of the patient. They have the right to know who is taking care of them and what's your title. Next. I think that's it for the delegation. So, in summary, delegation, assignment, supervision will be a big part of your nursing career, and you have to do it professionally, considering that you're accountable for each assignment that you give out and each task that you delegated. And you're not trying to, don't be lazy. That's it. Some people, when they said, "Oh, I'm the charge nurse, I can just assign anybody or anyone to them, make their life miserable." No, it's not like that. That's why sometimes some incidents happen because of that practice. They will just assign whoever they want. And then if they have friends, they will assign the simpler cases. I'm not saying it's not happening, but you might encounter those things which are quite risky. I will I have I have encountered those things, and it's unfortunate because sometimes it will be a cause of problem. Could be a cause that some nurses gets too exhausted because they feel like there's an imbalance with the assignment. And by the way, let me just add this: in some hospitals, if you see or if you feel that the assignment is unfair, if you're part of the union, they will have this process. They call it protest of assignment, and you have to complete that if you feel that the assignment is unfair or unsafe, so that whatever happens during the shift, you are protected. And I think that's it. If you have any question, feel free to